Hello, and thank you for joining us tonight for our free webinar, Intro to Divergent Channel Treatments for Joint Pain and Arthritic Conditions, featuring Leta Herman. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please make sure to use the Questions tab to assure that we see it at the end during questions and answers. Please note that each webinar is recorded, and immediately following conclusion, you will all receive an email with a link to view the video on demand, as well as a copy of the slides. And you may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs to practice management, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. I'm proud to introduce Leta Herman. She is a Chinese medicine instructor and practitioner, author, presenter, and speaker, and co-founder of the Alchemy Healing Center and Alchemy Learning Center, also podcast co-host of the Inspired Action podcast. She is a longtime student of Master Jeffrey Yuen and offers a wide range of alchemy treatments and workshops based on the principles of classical Chinese medicine and the 5 elements at her clinic in Massachusetts and in her travels throughout the world. Please join me in welcoming Leta Herman.
Hi, everyone. Thank you so much for joining us tonight. I'm so thrilled to be here again. I've been blessed with being able to do this webinar series with Jeff a couple times, with LASA, I should say, a couple times. So thank you again for inviting me back. And I do want to say before I start that Jeff is going to share a blog post from the first webinar we did, which was almost 3 years ago, which was on B syndrome, which I think if you didn't see that webinar after we're done with this one, you might want to go back and watch that one, because some of the topics we're talking about tonight, it's kind of a continuation of that webinar. And a lot of people asked for this topic. And so we finally got around to putting it in the schedule. And so that's how this particular webinar got started. So check that out if you haven't seen it already. And I'm excited for tonight, so we'll get started. So I just wanted to say what you can expect for tonight. First of all, I just want to familiarize you with the divergent treatments and get you started on thinking about how these treatments could fit into your practice. And, you know, in general, I want you to understand the benefits of, you know, what these treatments can do and whether you want to offer them, because you'll, as you learn tonight, you may not want to offer them. So, you know, from a beginner standpoint, you know, I know there's many people here who are very experienced, but I'm going to be speaking to beginners as well. So I'm trying to cover everyone who's here tonight. And so we're going to just really work on these beginner concepts. And I believe for some time that the divergence and the sinews, which are not taught very much, and I'm going to talk about both of them tonight, which aren't taught very much, are an area where practitioners and bodywork therapists can, you know, enhance their practice with, you know, more advanced learning. But there is a learning curve, as you'll see tonight. So I want you to think about, if you love this stuff, if you like the concepts, take a class or study with an experienced practitioner or teacher before you begin any of the treatments we discussed today. You know, this is an informational presentation. It's a dense topic, and we have an hour. So I've done my best to put some good stuff you can take away and practice with if you would like. If you're already experienced with this, I think that would be possible. If you're new to it, I really do recommend you do additional learning. And just because we were doing this webinar, I have put a class in our schedule in May 23rd. That's a continuation of this webinar. So I'm going to explain to you how you can take that class if you'd like. Okay, so where to begin? So we're going to, again, just the agenda for tonight. We're going to introduce you to the concepts of the 5-channel systems in classical Chinese medicine. We're going to talk about the role of the divergent channels specifically. We're going to talk about how toxins are stored in the joints and the concept of latency, and how to release latency using the divergent channel system. And then we're saving time to do some really good talk about how do you do the treatments. So there's something called SDS versus DSD. I'm going to explain that, and the needling techniques that are used, how to do acupressure needling, and essential oils as an alternative. And then also just really all the way through the session tonight, we're going to talk about why not to do divergent channels and what other methods might be useful. So just to keep you thinking about the divergence in that way. So just so you get to know me a little bit, Jeff did a great intro. I have an Alchemy Healing Center clinic. We just started the Alchemy Learning Center, which is an educational community for alchemy, Chinese medicine classes, an apprenticeship called the Master Alchemy Program, intensive courses for practitioners and healers. We have cupping and gua sha classes that are online and always available for people. We have classes on things like releasing chaotic energy, if anyone works with aggressive energy or wants to learn more about that. So there's lots there. We have an Inspired Action podcast that's in wherever you listen to your podcast, that's on all of these topics: alchemy, 5 elements, 9 palaces. That's great for your clients as well. It's really geared towards lay people, but anyone that's interested in it. And we just released a new book called Through the Mystery Gate that's about alchemy. I will mention a little bit about alchemy tonight, since that's kind of what we've been working on with this new book. We also have books on the 5 elements called The Energy of Love, Connecting Your Circle, and a gua sha book as well. And we have a publishing company with Jay McElroy, and Jay McElroy wrote the other books with me as well. And we published a book by Dr. Mary Ryan that is on Tibetan medicine for anxiety, and it's fantastic. So you could check that out if you're interested in that. So I've been practicing for 20 years. I'm using my fingers as needles. I'm an acupressurist. I've studied with Worsley students, teachers who have been Worsley trained and studied for many years now with Jeffrey Yuen, taken the advanced acupuncture program, and also many trips to China and around the world with him. And so what I think of myself, and what you'll get tonight, is that I offer as a teacher a practical perspective plus the theory. So I take a lot of this theory and I put it in my own practice, and I come out with these nuggets of how do we distill all this dense information into something that we can actually put our hands on people and do. And that's what I do in all the classes that Jay and I do, and in all of the intensive, apprenticeship programs we have. It's really about how do we bring this into our practice. And so that's what we'll do tonight. So deep breath. So let's talk first about what are the divergent channels, and in the context of the 5 channel systems. So everyone knows about the primary channels. And when we say meridians, we just assume you're talking about the primary channels. So the meridian system that is on this doll is just the primary channels. But there are 5 channel systems. There's the sinew channels. Those are the muscles, tendons, and ligaments, the what we call the way level, or the defensive chi level of the body, the exterior of the body. And then there's something slightly deeper, which is the Luo channels, because they're related to the blood. So underneath the sinews is the blood and what we call the collaterals. Beneath that is the primary channels. And this means the true or upright channels, and they're related really to the organs. They connect into the organs, and so they're at a deeper level than the first 2. And then the divergent channels come in, and what they are is the offshoots from the primary channels. And we're going to explain why that is. But it means that the name means that they're distinctly separate and next to the primary channels. So we'll explain what that means a little bit more. And then many of you know the 8 extraordinary vessels, and this is the deepest yuan level. So it's the deepest level of the body. There's actually a 6th one that I don't usually include, but I thought just for the heck of it, that the 6th channel system is actually the real surface of the body, the 12 cutaneous regions, which are mapped according to the 6 divisions. And so you treat that system through the sinews or divergence, and they're related to your sensory orifices. It's just a side note. I just thought in case anyone was interested. So what are we talking about tonight? So this is ancient wisdom that was lost or almost lost, because we're bringing it back today. And Jeffrey Yuen has done a great job at bringing the divergent channels out into the teaching of, classical Chinese medicine teaching. So the primary channels really took over in terms of taking precedence in modern acupuncture after the Song Dynasty. And so the other four systems took a backseat. I think the 8 extraordinary vessels have kind of been resurrected in a lot of schools today, acupuncture schools, but the others haven't so much. So the emphasis, what happened in the academies that were teaching Chinese medicine in China is they started emphasizing the primary channels and then only talked about the other channel systems based on the points that exchange between the primary channels and these other systems. So that's how we get the opening points of the 8 extraordinary vessels. So there, if you're doing spleen 4 for the Chiang Mai, and that's all you're doing, you're not really doing an 8 extraordinary vessel treatment. So there's way more to that system than what maybe you were taught. I'm not saying, everyone's that way, but some people are teaching it more like that. And that's how it was taught in China for a long time after the Song Dynasty. So the other thing is, these points are interesting points because it's where these channel systems converge or meet up or cross. And so they're called Hui confluence points, and some of them are Hui meeting points. And they're transformational points. And just as a side note, a lot of them are located near lymph nodes. So that's interesting. It's got to do with the immunity, and a lot of the lymphatic system hones into the chest. So these divergents do as well. And the things that gather there, they get tight because it's a junction. And so there's a lot passing through there. So you can think of it that way, these points that we're going to be working with as divergent channel points. So, again, after the Song Dynasty, they only really taught the confluent points as like, a side note. It wasn't that important. So what are we talking about tonight? Now, divergence can be used for a lot of different things, but tonight's topic is really about the toxins that are stored in the joints. And so the body is supposed to naturally eliminate pathogenic factors. So emotional toxins, chemical toxins, or any other kind of toxins that the body's taking in, the body should naturally eliminate. But what happens is the body sometimes can't deal with toxins past, meaning like a PTSD emotional event or current. And if it's overwhelmed, by emotional states, a current difficult life scenario, or as I mentioned, a PTSD issue, or they have a physical illness that's overwhelmed the body, and now these toxins, the body can't process them, or the environment itself is toxic for real, like physically toxic. Again, that's an overwhelming state. Even just an intense physical or emotional stress, you're going through a divorce, or you do this crazy, ultra race. And not that, I love the idea of ultra racing, but, if it's too taxing on your body and there's a lot of toxins simultaneously, emotional or physical, it could be too much for the body. And so then your body has to do something with those toxins. And that's what we call latency. So it's never too late for latency, meaning that your body, this is a good strategy. The body is going to say, uh-oh, I can't get rid of these toxins. Now what am I going to do? So the Wei Qi or defensive Qi system is overwhelmed by a pathogenic factor, by toxins. They're not being eliminated because of those reasons, or even you might just be too distracted in your life. You've got too much going on and you're not attending to your health. So in addition to toxins happening, you're eating, maybe not that healthy, you're not sleeping well, you're putting your body through additional stress. So you're distracted. And so then, these toxins threaten the organs in the body, because as they go deeper in the body, now the organs are going to be affected. So the Zongfu are threatened by these toxins. So what happens is the body has to store them. It has to find a way to put them in a safe place so that you can deal with them later. And that's the concept of latency. It's like taking out a loan that you're going to pay back later when things are better for you financially. But in this case, you're taking out a loan for your future health. So you're gambling that you're going to feel better later, and then you can eliminate those toxins. I say it's a gamble, but you really have no choice. Like, it's a good strategy from the idea of your body at a cellular level, because you're always putting survival first. Your body is a very smart mechanism, and it knows that this is a smart way to deal with something that's overwhelming the body and it's toxic. So I always tell my clients this, hey, you have this joint problem. The good news is your body's doing that for a good reason. That means that you're healthy. That means that you're alive and healthy and everything's going well. And, your body just said, hey, I'm going to put this aside until later. And maybe now's late. Maybe now is the later. Maybe now things have calmed down and you can actually deal with them. So I thought before I continue that I would just spend a little time giving you some real life examples, because I think for me, this is the most important thing, because I think when I started Divergence, I kind of thought of it as a side note. I was like, it's interesting. It doesn't really get me that excited until the first time I had someone who had hands like this, and like in the picture. And I did Divergence for another reason. I think that person had neck pain. And, maybe we did it for a month or two. It wasn't that long. Okay, so they looked, pretty, knobby and bulbous. And then she came in, I think it was, I would say 2 to 3 months at most, and said, oh my God, look, Leta, my fingers are normal. And I think I was more shocked than her, because I really never thought it was going to make it actually go back to normal. I knew that it was like theoretically possible, but when I actually saw the effects of it, I couldn't believe it. So I want to say that for me, these treatments feel very miraculous, and I don't do them that often, and you'll see why. But when it's right and when it works, it's pretty, for me, miraculous. So just some examples. This office worker came, and, a lot of people have texting thumb, but this person was getting it from doing the space bar. There's, mommy thumb, I guess, and biker's thumb, and all kinds of where you really, mess with your thumb, and then you might get a swelling in one of the joints, or you might get, a deformity of one of the joints. And so this particular man had swelling, and it started to look like it was getting bulbous in this knuckle. And we did the work, and within, I think, 1 round, which you'll figure out what 1 round is, 3 weeks, it was better. The pain went away and the swelling went down, and it eventually returned to normal. The woman that I already told you about was the second example. The third example is that, and this was the very first person I ever did this treatment with, like almost 20 years ago. She had a lifetime of pain. She had sciatic nerve damage from falling out of a tree. That's what she thought. And I do think she actually had nerve damage, but the pain she had was constant, and she was taking so much pain meds, her whole life. So I think when I met her, she might've been about 40-ish. So we did this treatment, and again, maybe a couple months worth of the treatments, and she literally had no pain. Now, she still had some nerve damage, and the pinky toe especially was affected, but the actual low back pain that she just had constantly, the sacral area pain that was, she couldn't really sit at work. It was always a problem for her, went away completely. So that for me was my first experience with Divergence. So you can see why I say to myself, it's kind of miraculous. Just some other examples. A long-term client who didn't really have a history of arthritis per se, but suddenly her knee swelled up and she hiked every day. She was a big avid hiker, and for her this was very scary, and the doctor was saying, oh, we think it's arthritis. So we did the Divergence, and right away she was back hiking again. And I don't think it's returned, and it's been maybe 2 or 3 years. Another very amazing example is working with rheumatoid arthritis. Again, these are very intense cases, so you really need to be you'll see when I talk more about it later, very vigilant with this if you really want to go for it. Now, this woman was really severely impacted. Her leg was at kind of almost a 45-degree angle from the knee down sideways. And so we were dealing with severe pain, severe, arthritis in all the areas, the fingers, everywhere, shoulders, hips, knees, everything was affected. And she couldn't work. She'd closed her business. And so we did probably a year's worth of work very intensively, much to the book. And she was completely restored in terms of no more further deformities, no more further joint swellings, and a lot less pain. The knee itself, I believe the angle went back quite a bit, but it did not fully restore, and she eventually got knee surgery. But the fact that she was able to even get knee surgery was pretty amazing, because for a long time it didn't seem even worth it. Everything was in such flux and the doctors weren't really interested in doing surgery. So I always looked at it as, even though we would have loved the knee to go all the way back to normal, which, at that point maybe wasn't possible, at least she was able to live a normal life now. So everything really did sort of calm down, go back to a state where she could live, a fairly normal life. So, whereas before it was nearly impossible. Okay, so before we get into the treatment, just to understand how the body stores those toxins, where do they go? So there are 3 levels. The first level is the Leta channel system. Remember the 5-channel system. So the first level is sinews and the second level is Leta. So the second level of these 5 channels is where the first, sort of level of where toxins go. And so how you know whether this is an issue is if you see spider veins and varicosities. So the Leta channels sort of spit out these little spider veins to store mostly emotional toxins. So this is where, just having, going through a really tough time, maybe you're getting a divorce or something like that, and suddenly you get all these little spider veins. So that would be a pretty normal thing. Or if that system gets overwhelmed, it does something which is called emptying the Leta. And if you empty if it empties the Leta, you might get nodules, fatty lipomas, ganglions, things like that. And that's also a Leta issue. So it's related to Shen disturbances, inability to sleep, like insomnia, and they're bled when you treat them. And if you get dark purple blood out, it really does show that the evidence that was an emotional toxin. This is a class on the Leta channels, so we're going to probably not talk about that again, but that's an interesting topic. Not my specialty, but we have other people. If people are interested in that, let me know, and we could put together a Leta webinar someday. Next is divergence. So that's the second level of where the body stores things. So as you know from the topic of this webinar, it's about storing it in the joints. So basically, this is where the B obstruction webinar we did 3 years ago might be interesting. This is what we're talking about. It's called B obstruction. It's pain in the joints. You might call it arthritis, but in Chinese medicine, we call it B obstruction. So it's about holding that overflow until we can deal with it later. And you can think of the divergence where there's got to be a place like a delta on the sort of tail end of a river where things can spread out. And when it goes into the joints, it's going into the Jing or Yuan level, but that's a blessing. It's diverting something dangerous away from the organs. I already said that, but just to reiterate it. And the good news is it's not going to kill you. It may eventually someday, overwhelm the body, but at this point, as long as you don't keep putting more and more toxins in, the joints will hold it. And of course, it's going to cause issues. So we're going to talk about the degradation of the joints because the toxins are there. The third level is the 8 extraordinary vessel level. So this is also the Jing level, but this is the last ditch effort for survival that the body goes through. This is where we put toxins into deeper than the Zongfu, even deeper than the joint level. It's really literally, I think of it as the DNA level. So they say that when you're healing this level, you're healing up to 5 generations back for a person, because what happens is if it goes into this level and you procreate, then you're going to pass that on to the next generation in the hopes that that generation can resolve the pathogenic factor. So this is where you'll see where there's a history of, I don't know, gluten intolerance, because somebody had a traumatic event while eating gluten, and then suddenly it gets passed down generation to generation. It's kind of a strange example, but that's really what we're talking about, is on some level that parent couldn't deal with whatever that toxin was. It was just emotionally overwhelming, and so it goes into the Jing level and gets passed on to the children. So the other thing I want to just say before we get into the treatment is, what if the trauma is so intense and that latency is holding a lot, but it's also like it's your present moment. So this is where, who are you going to call? Ghost points. Okay, so this is a big part of the work I do, because I don't jump into divergence right away. I would say I really wait before I do a divergent channel treatment, and you'll see why. But a lot of times I would prefer to work on the trauma that may have caused the toxins, to be overwhelming the body, and work on that, especially if it's really obvious that there is a lot of trauma. And so ghost points unhook you from the past. If the past is haunting you, then the ghost points are very helpful. I do the ghost points not just one at a time. I do the 13 ghost points in a half-day treatment, like 4 to 6 hours long, because these are things that people need to get, their hearts need to speak about. And I had a therapist the other day tell me, I hear people's traumas all day long, but I only give them an hour. And you gave me, it was the first time, she said, I have ever told my whole story. And that was so healing. So just giving extra time for people to express what's needed and doing the energy work at the same time is very powerful. So this is for PTSD and just, I'd like to say a clean slate before you do the divergence, to address the trauma state that might not enable you to be able to even do the divergence, because I'm going to explain a lot about when you should do divergence. And one of the times you shouldn't do it is when someone's in a trauma state. So we're going to have a Ghost Points class, a live stream class on July 17th. I'm going to tell you at the end how to go to the Alchemy Learning Center. But if you're interested in the Ghost Points, there's that as well. Okay, so what should you look for? So as I explained, there's the 3 levels. So if you're seeing a lot of varicosities and spider veins and the person's in emotional distress, it's not that the divergence won't be helpful. They can be, but I would maybe look more towards the low channels. Whereas if you're seeing someone coming in, just really their main complaint is joint pain, it's long-term, and this is really key, especially if there's been a progression of joint pain. If it started in the knees and maybe the neck, or even the spine, then it went to the hips and shoulders, and now it's in the fingers, and you're seeing some of those fingers we're talking about, that's a typical divergent progression. So that's definite yes. If it's like just in the hips, yeah, we can work on it, or just in the shoulders, yes. But did it start in the knees? You can ask them that. And they might say, oh yeah, when I was in my 20s, my knees were hurting me. And so that's just something to think about. Are there joint swellings, or are there joint deformities? Yes, definitely it's something to think about doing the divergent channels. If instead you're really not seeing a lot of joint pain, but you're seeing a lot of autoimmune illness, maybe lupus, there's maybe some kind of viral load in the body, history of shingles, or maybe mono, like the long haulers we talk about COVID. We've been seeing long haulers, we all treat long haulers. Maybe they have mono, Epstein-Barr, some other kind of virus. So we've all been doing long haulers for a long time, and I don't think COVID's going to be that much different, but I haven't had a lot of long haulers personally, so I'm not going to speak too much on that, but I would assume that they would respond very well for For me, that's a DIMI treatment. So we're going to talk a little bit about DIMI at the end. And one of the symptoms is there's some weight or bloating around the middle, around the belt channel. And just in terms of these 3 levels, there is pulse diagnostics you can do, but it's very complex and way beyond this webinar's level. And honestly, I am very, take a lot of pulse taking, but I really look at the signs and symptoms on the body itself for a lot of these decisions that you have to make. So when you see evidence of all 3 levels, you see the varicosities, you know that there's the history of the joint pain, and then you also see some of maybe the viral issues. This person might not be well enough right now to eliminate any toxins. So you have to evaluate, how is the strength of the person? If they're already overwhelmed, if their blood and chi isn't strong, if their vitality is weak, and they're overwhelmed, dredging up toxins from deep down is the worst thing you can do. You first need to settle them. You first need to get them in a good place so that they can deal with the toxins that you might be dredging up. So that's why I wanted to talk just briefly about cupping today. And here's a person, look, they have some varicosities, you can see by the arrow, and obviously the cups are getting quite purple. So you're going to see that this person has a lot going on, probably at all 3 levels. So what would you do with this person? Well, again, you can really think about the blood and chi and vitality of that person. Is this person someone who you would want to do divergence with? Or would you try cupping first? In a lot of cases, if it's just like a hip pain, I'll be like, hey, let's do some cupping. Let's see how that goes. How do they react to that? Backs, necks, hips, shoulders, they respond very well to cupping. And that might be just enough for them. It's not that I think anyone would want to do divergence so that when they're 80, they're everything's not breaking down. I mean, if you're healthy, I would say everyone could do with a divergent treatment just to prevent that happening when you're older. Because as you build more and more toxins, it's going to degrade the joints more and more. So, but that's not the case for many people. They're just not able to do it. So you can release the toxins through the skin, through the whey level. And are they going to get relief from that? If so, then maybe that's it. And if not, you can proceed to the divergence if that's the appropriate treatment. And even in this case, you would end with the Jingwells, as we do with the divergent channels. So I'll explain that a little later. Just to give you an example, many people I've worked with, even those who are strong or weak, have found great relief for cupping. So these are the Dongbang cups, by the way, I love them. And so, you might only do 5 or 10 treatments and the pain's gone. So, why would you go into the divergence? As you can see, they're quite extensive. I had a woman who loved riding a bike. She loved to walk. She couldn't do either for over 2 years before I saw her. I think I did 10 treatments on the hip and low back, and the pain was completely gone, and still gone like 5+ years since. So that's great. Sometimes surgery is going to be the solution for the person. You don't need to heal everyone this way. One person came in, had a very strong vitality, but no time in his life to actually address the healing that would be necessary to do the divergence. I tried cupping. 5 minutes of cupping brought out the worst blisters I've ever seen. So obviously this person had a ton of damp heat in the hip. And he opted right after that for a hip replacement. He didn't like the blisters. I don't blame him. And so it just wasn't the right time in his life. He was a store owner. It was going to be too much to undergo that divergence. So great. So he got the hip replaced. He's, riding his bike, walking, doing everything now. So great. It's just not a match for the divergence. So the divergence are not the be all and end all to every situation is the theme of what I'm trying to get at. So let's get into treating with the divergence and making it simple, because as you can see by the sign, it can look very complex. So let's first say that divergent channels are a two-way street. There's elimination, but there's also putting something into remission. So we're going to talk about elimination only tonight. Clearing the toxins out through the divergence is the elimination strategy. The remission strategy is, this person's in deep doo-doo, like the serious problems. And if we don't get those toxins stored better in the body, the person's going to die. So, you know, what we're doing is it's a remission strategy, a metastatic cancer or something like that, where you're trying to extend the person's life with the same strategy that the body uses, only the body hasn't kind of done it enough. So displacing the toxins from those organs into the joints. And to me, that's always felt, I don't enjoy that concept, but I have had to use it and it does work. And it's not something I do very often, because it just, to me, I'm always wanting to, you know, release and get stuff out, but you have to be honest sometimes and just say, hey, this person cannot release. This is not going to work. Or just don't do the divergence. Okay, so when we're doing divergence, this is also something that's really different than the primary channels, is which comes first, the fu or the zong. And the fu organs, which are your yang organs, your organs that process things like the bladder, the large intestine, the stomach, those are the more important organs in the divergent system. And usually in Chinese medicine, we emphasize the zong organs all the time, the spleen, the liver, the heart, you know. So the fu are the outlets for the yin organs. So if you're really angry, there's you got to have an outlet for that. So you might go to the gallbladder instead of the liver. So what happens? It breaks up the stasis. It releases long-term things that have been pent up. So you begin by opening the fu in every case before the zong. So you're giving those organs the outlet before releasing anything from the zong organs. So the divergents also have a very different sequence. This is not a primary channel sequence that you see at all. And there's lots of, you know, theories and reasons why that is. But here's the sequence. The first is the bladder and kidney. So really just the bladder, because we're not necessarily going to do the zong right away. And that addresses the knees and the spine, so the neck and the back and the knees. The second level is the gallbladder and the liver, the pair, zong, and that addresses the shoulder and hip pain. Now notice it's in the sequence of how these events happen. Usually it starts with knee pain, then it goes to hip pain, you know, then it continues. Then the next level is the joint swellings. And again, this is how these things happen in the body. The joint swellings don't usually come right away. Usually there's pain and then the swelling. And then lastly, the deformities, because you usually don't get the deformities until you've already started seeing swellings. So where the joints are actually deforming. And so that's, you know, especially evident obviously on the fingers and definitely sometimes on the toes. The rest of the divergence we're not going to talk about tonight, but those are used for remission strategies. So it's a much more advanced topic. So let's talk about needling. This is also very different than any needling you've probably ever done, whether using needles or techniques that like acupressure that we're going to talk about tonight. There are 3 depths. So as you know, if you practice acupuncture, you can put the needle in at the surface, you can go down to the middle level, or you can go down to the yuan jing level. So we're going to be interested in just 2 of those depths, the surface and the deep level. So the techniques are called surface, deep, surface, or deep, surface, deep. And I'm going to explain that. So the surface, deep, surface, which we just say SDS, is the releasing technique to take the toxins out. And the DSD, deep, surface, deep, is the remission technique. So it's driving the toxins deeper. So SDS is for those healthy enough and in a good life situation to handle the elimination of the toxins. And the DSD is for that critical state I was talking about, for someone who may not survive unless things get put into remission. So tonight we're not really going to talk too much about DSD again, as I explained, but we're going to talk about SDS. So how do you do an SDS treatment? So this is the same whether you're going to use a needle or your finger as the needle. So you connect with the surface, the Wei level, and then you go to the yuan level, and then through the needle intake, then you bring that back up to the surface. So the SDS brings the toxins out to the surface. And when you do this, it's a vibrational technique. So it's going to be a very fast wiggle, 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 or wiggle, wiggle, wiggle with the needle. And I like to say 5 seconds minimum. You can do it for as long as you want to. But really, it's like when you get Da Chi, you're waiting to really connect with that wave level. And then you're going to go down. So if you're using your finger, you can do it energetically. If you're afraid to do the needle that deep, you can really send that chi down to that level and not have to needle quite as deep. I mean, some of these treatments were 3-inch needles. So, you know, how deep is deep depends on where the point is, of course. But, you know, for people needling, that may be intentional. It's up to you. But for your finger, it's definitely intentional. You're going to push somewhat, but you're also going to send your chi down there and really gather that toxic chi. So you're going into that yuan deep level, and you might feel, at least for me, I'm very sense oriented. You might feel nauseous. You might feel a negative vibration as you connect with it. Remember, it's toxic, so you might actually have a sense of that. And then if you grasp that, then you pull it back up. So you bring that back up to the surface, and then you vibrate again. So at least 5 seconds in each level. Surface 5 seconds, below 5 seconds, and then come up 5 seconds. So when you do that, you can repeat it a number of times. I usually do it 2 or 3 times in each treatment, sometimes many times. If it feels like we have to do a really strong treatment, I'll explain that later when that's the case. But however many is appropriate. If it's the first time you're ever doing it, you really only want to do it a few times because you're going to test the waters, and I'll explain why in terms of digging out these toxins. You don't want to overwhelm the person. So again, my non-needling technique for those of you who are bodywork therapists, it's basically like your finger's the needle. You're going to go into the surface level and you're going to start to vibrate. And as you vibrate, you're going to now bring the tension and press harder, but really send your chi down and again, you know, use that vibrational technique and then bring back the toxins out to the surface. And I was going to say that the 8 extraordinary vessels are similar. If you're doing non-needling needles, then you're going to go much deeper because you're going to go down to that yuan level. And in that case, it's a much slower vibration. So if you're doing a daimai treatment, I always think of the bottom of the ocean and how the seaweed moves. And that's sort of how you use that technique for an 8 extraordinary vessel treatment. Okay, so if you don't know gua sha, I encourage you to learn it because that's a key factor in doing these treatments. And this is a shot from one of our gua sha classes, so you can check that out. So before you do any divergent treatment, you need to first clear those cutaneous regions. You need to get the chi at the surface to be freed up. So you have to clear those pathways so that whatever comes out of latency has a place to release itself. So gua sha can, you know, preemptively release those regions. So every gua sha treatment, you have to do every divergent treatment, you have to do gua sha first. And generally speaking, we do them on the neck and the mid back, upper back area. There are 3 zones in gua sha, and so those are the first zones. And then the third zone you could do as well is around the bao mai. It's around the channel underneath the breasts. So it's all the way around the underneath the breast, so the ribs and that area. So for today, since we have so little time, and I can see that it's going very quickly, so we're going to just give you one example, just so you can take it away. And I really want to say that if you aren't familiar with this kind of work, then maybe, you know, get some further training before you do any divergent treatments. But just so you understand the concept, I put an example in here. So if you're going to do a bladder treatment, which is always the first treatment in divergence, it's rare that I don't start with bladder. So if you're going to do a bladder treatment, you would begin with the gua sha on the neck and the back to release the exterior before bringing any toxins out, really promote that release. Then you use the 2 confluent points for the bladder channel, and that's bladder 40 behind the back of the knee and bladder 10 behind the occiput. So you're going to do the SDS points. You take your time, though the first time you don't do too much. And then you end with bladder 67, which is the Jingwell point, because that also enhances the releasing toxins to the exterior. So we just want to open everything up to the exterior to give that pathogenic factor away out of the body. So in general, all divergent treatments are very intense. They need to be done 3 days in a row or don't bother. And so the way it works is you do 3 days on, 4 days off, repeat 3 weeks in a row. So that's a very, can you get people to come in that often? There's a big question there. And even if later we're going to talk about essential oils as an option, even if you're doing that, you still need them to come in some of the time because it can be quite intense and you might need to, help them through that process. So after 3 weeks, you reassess. You can also give them a week off and then continue either with the same level, bladder in this case, or you could add kidney for certain reasons, or you can move on to the next level, which is gallbladder, and especially if there's hip and shoulder pain that you're working on. So essential oils, it's really exciting to me that this is an option because I think it's really enabled us to do a lot more divergent treatments than we normally would do. We still see the people, as often as we can because the physical treatments are so powerful. Also because if they are having reactions to the treatment, you want to be able to see what's going on right away and mitigate that. So the best example for me is they come in the very first week twice. Maybe the third day they do essential oils. You send them home with the essential oils, and then they do that subsequently for the next 2 weeks if everything is going well. You have them come back in maybe that 4th week or the next month and check in with them, maybe change the essential oils to the next level. So you're going to keep going in that like 1 month cycle. So the bladder divergence, the SDS, essential oils are jasmine and pine or lucia, and it's mixed with safflower or carrier oil. So that's all for all you essential oil people. But again, you really need to learn more about the divergence before you get your essential oils out and start dabbing. It's a good idea. Oh, and by the way, they're placed on the points if I didn't already say that. The client does that. So your actions will cause reactions. So I'm actually disappointed if the divergents don't have any reaction because I kind of think maybe we're on the wrong track because it's so frequently common that there is some reaction. Doesn't have to be any specific reaction, but as these toxins come out, the person's going to feel something. If they feel nothing, I still try to complete the 3 weeks and then assess to see if there is a difference in the pain. I definitely don't go by reactions 100%, but it's typical that there's no change in that case. So I'm on the wrong track if that's the case. So typical reactions: diarrhea, frequent urination, skin eruptions, deep emotional releases. The pulses can be floating and empty on the way level. All these things are saying slow down. The body is getting overwhelmed. So that's why the second day they come in is so important, because if they're having a severe reaction, I might not even repeat that particular divergent that day. I might just do a lot of gua sha. I call it cleanup on aisle 9. So, what's going on? What do they need? How do we get them to release this? I'm doing Jingwell points. I'm doing gua sha, maybe some cupping. I'm trying to figure out how to help the body release this up to the surface. The worst thing that I've seen is shingles can actually come up, and it happens enough that I need to mention it. So you need to have a good strategy for treating it, which I'll cover in our longer class, because it's happened enough times that I'm aware that it's an issue. I've gotten so good at knowing about it that I usually treat it before it gets diagnosed by the doctor, and by the time it's diagnosed, it's already almost done. So it's kind of like a mini shingles outbreak. So just to know, that's why you have to kind of know what you're doing and pay attention before you embark on this. I always tell people we're not going to do this before special events, holidays, weddings, emotionally charged times, not a time to do these treatments. So again, there's 3-week cycles. So you repeat 3 rounds, 3 days on, 4 days off, 3 weeks in a row, then reassess. Are you going to add or are you going to repeat? So for anyone that is ready to do this, you've already been working with Divergence and you just want to like get a brush up and you're going to go out and do it tomorrow, I just want to say, go slow. This is a powerful treatment. You don't need to do it with everyone, and start with like a mild test of the treatment, like do a little bit and see if the person reacts. And no reaction's great. Do a little more, go a little more intense the next time and see how that goes. If it's a severe reaction, then you need to have your cleanup on aisle 9 strategies. I like gua sha, I like Jing Wells. Maybe you have other things. Maybe there's heat in the body. You could do some heat releasing, whatever comes up. If there's a mild reaction, that's kind of the optimal place you want it to be, because that means, yay, we're doing it. And so you kind of repeat the same treatment, almost exactly the same, maybe a little more if you feel confident. And, hopefully what we really want is just a little bit at a time. We want the body to just say, okay, I'm going to release this little bit and take it out of latency. And I'm going to process that first. And then the next day, oh, I can release a little more. And then the next day, oh, I can release a little more. And then a little break so you can catch up and not be overwhelmed. I just need to mention the daimai, because to me, Divergence and daimai are on the same level. I often am deciding, is this a daimai issue or a divergent issue? So for those of you who already know about the daimai, I know it's a little bit more used in acupuncture than Divergence, so you may already be doing daimai treatments. I'm talking about releasing daimai treatments where you're dredging stuff up again from the yuan level. So is the person strong enough? That's still a consideration for daimai. You have all the same issues. You don't want to do a daimai treatment with someone who's not strong enough. Also, it can bring shingles reactions. But in general, if you're having a lot of strong reactions with Divergence, you can also look at daimai as an option in general, especially if there's a lot of crossover symptoms like we talked about in the beginning. So the daimai in particular, if there's damp, heat, or cold in the lower or middle burner, if they're holding a lot of water around the middle, they have bloating in the lower burner, they feel like their muscles are weak, they might have exhaustion, again, from some kind of viral load. They could have cysts, endometriosis, hemorrhoids, and there's a lot of those indications. Then daimai might be better overall than Divergence. So, and a lot of the same things happen with daimai. And actually, everything I just said about reactions can happen with daimai. I had one woman who was doing daimai who literally had phlegm coming out of every orifice all at once. She would come into my office the next day, just like phlegm everywhere, just miserable. And we were so excited because it was working. So she literally transformed her life with that daimai treatment. So in summary, before we end, we're going to, look at Divergence as somebody's, I like your little emojis. Someone who, all of us, sorry, I lost my train of thought. All of us can do something else first before jumping into the Divergence. So what can you do for the joint pain? Well, you can do cupping. Maybe you're going to look at more like daimai if there's different kinds of symptoms. So, think about these things before you do anything like the Divergence. And then, always assess the person's vitality and life situation, because we really need to pay attention to the fact that overwhelming someone more just means the toxins are going to go right back in. They aren't going to come out. So it's pointless to do Divergence if you're overwhelming the body. We're going to start with the food channels. We're going to always begin with the bladder. It's like the way that, think of it this way, even if the hands are the big issue, you still start with the bladder, which is the knees. because what you're doing is you're opening up all the pathways all the way up to the small intestine channel. Remember, it's a continuum: bladder, gallbladder, stomach, small intestine. So we have to go that way to kind of dredge out the toxins from all those other divergents before we get to the bulbous, knotted hands. So that's how to think of it. And the treat 3 days on, 4 days off, and then you'll usually see some results within a month. It's pretty amazing to me how quickly I see results. Obviously, if someone has a severe problem like rheumatoid arthritis, don't expect everything to turn around in a month. But a very tiny issue like the man with the thumb, it went very quickly. And if there's no reaction and no improvement, okay, so wrong treatment, what else can we do? It's got to have a little humility with this one. And so again, just take a class or study some more. If you're not an experienced practitioner, talk to someone who is before you begin these treatments that we talked about today. I really want you to know this is an informational presentation. So, and I just wanted to say, I promised that I would tell you about the Alchemy Learning Center. We do weekly live webinars every Wednesday night for our members, and a lot of it's on the 5 elements, the 9 palaces, and alchemy. We have this educational community with online classes. We have an intro to alchemy. We have releasing chaotic energy. We have understanding the 5 elements, the 9 palaces. We're doing a divergence class on May 23rd, and an alchemical grieving treatment for people who are have bereavement, are stuck in their grief after someone dies. And we're doing a ghost points class in July. So we have one each month. So if you want to learn more, there's the dates of the classes that are coming up. We have the 9 stages of alchemy is also something that we do. And so that starts stage 1 in September. So that's basically a lot of different information. So if you go to upcoming events at our site, you'll get the full list. How's that, Jeff?
I think that's perfect. I do want to let you know, I didn't want to freak you out during the webinar, but I do think your site's having a little problem. Maybe it's all of the traffic of all the people trying to get there, but it's not loading at the moment. So there is a link.
Oh,
yeah, for your website, for the Alchemy Learning Center. I know, but there is a link in everybody's email. So I would, suggest checking tomorrow and maybe reach out to your web host tonight and just let them know. But I did want to let you know now, not during the webinar.
Yeah.
Everyone really, really enjoyed, and we actually do have a fair amount of questions. So I would love to get right into it if you don't mind.
Okay, great.
All right. So first question, going all the way back to the beginning of our webinar. Do you think Baker's cysts would also respond to this approach?
Yes, I have used them, but you have to remember that that's more of a low channel treatment, because that would be the emptying of the Luo. Remember, cysts or nodules or lipomas are often Luo treatments, and I've actually literally seen them go down in front of my eyes by treating the bladder Luos for a Baker's cyst. So, it's a sketchy area. You have to kind of evaluate the whole situation.
And I would like to let you know there are at least 2 people in this webinar that would like a Luo webinar. So they both said it in the chat in the questions.
Okay.
So I'm guessing that there's 2 that said it and more that also would like it as well.
Absolutely. Okay. All right. We'll keep that in mind, Jeff.
And the next question is, how many treatments per week was the patient treated that resulted in success after 3 weeks?
Oh boy, quite often, but they're minor cases. They're not the major cases. They're, people who are in pain and it's bothering them, but it's, maybe it's some neck pain and it's not huge, but it's like really bothering them, or hands or, knees. And then so I'd say a large percentage.
Okay. Do you have any success with treating trigger finger?
I think trigger finger falls right into this particular topic. I haven't really worked with it as often as some of the other particular fingers, but that's just, I haven't seen as many for some reason.
I'm wondering how old some of these patients are with visible arthritic nodules.
You know, oddly, I see people as young as occasionally in their 40s, sometimes definitely in their 50s. So pretty young, but obviously much more in their 60s, 70s, 80s. But once you're getting to sort of the higher ages, then you're also going to be seeing people who cannot do the treatments. So again, when I see people in their 40s or 50s who are suffering from joint pain, I'm like, hey, why not do it now before it becomes a real big issue in your 80s when it's too late to do it?
All right. Let's see. We have tons of great questions, by the way.
Great.
Let's see. Does neuropathy fall into the category for a divergent treatment?
I don't see a direct correlation with neuropathy itself. I certainly haven't, I haven't done divergence for that. And I'm trying to think of people who have had divergent issues that I've done divergence, and I don't think it's improved the neuropathy. Sorry to say.
Okay. Do you see substantial phlegm, such as uterine fibroids, as a similar latency problem? Can that be treated through divergence?
Technically, I would choose DIMI for that case, but I would look at the overall, all the signs and symptoms. And if there's a lot of joint issues, then I might start with divergence, even though there's also that other symptom. Or if it's really primarily the fibroids, then I would maybe go more with DIMI. However, I have to say, again, we need a whole class on the DIMI. So give your votes on DIMI, because the DIMI treatment for fibroids can be so intense that I've had someone even have to go get a DNC afterwards, because it's just like so overwhelming. So you have to be careful even with the DIMI.
Let's see. Can we use these treatments for skin conditions like psoriasis and eczema?
I do believe that yes, but it's a whole different system. So divergence can be used for that, but I am not typically using them for that. That doesn't mean it can't be, and you'd have to do further research for yourself to figure that out.
And then do you think bunions, SP, alignment issues are amenable to divergence?
Yes, bunions for sure are very amenable. Spleen, what was spleen? And then
spleen alignment issues?
Spleen alignment, yes, absolutely.
And then,
although I just will say that a lot of bunion issues also need a lot of tonification of the spleen, and spleen 3 in particular. So I may not jump into divergence just for that. I really am looking at the spleen alignment, and then just the strength of the spleen channel might be more important in that case.
All right. And then how about plantar fasciitis?
That's a good one. I've not really used divergence for that. Not saying it couldn't help, but I would do sinew treatments. So this is so great, because the 5-channel system that I started with, we're going to have a sinew class. So the sinews would be much more effective for the plantar fasciitis.
And of the same kind of token, let's keep going. How about gout?
Gout. I look at gout as a deeper issue. Might be better to look at DIMI or just any kind of primary channel treatment that you choose, but not sure. I know that it has the joint itself is often affected, but that's not why the joint is painful. So not sure that would be the best strategy. You could try it.
All right. And then it looks like we have a few more questions left. How are you doing on time? Are you okay?
Yeah.
All right. So repeating STS 3 times, is that per point in one treatment?
Per point in one treatment. Yes.
Perfect. And then this treatment seems strong for fibromyalgia patients because they're so deficient. Do you have any suggestions?
I agree. And I wouldn't say fibromyalgia is a joint problem. So I wouldn't put that in the divergent channel treatment category, oddly, unless there is a lot of joint pain. So I would say that I would look at the primary channels and, develop your fibromyalgia strategy, what you think works. So I could go into a lot of detail of that, but that's not really the topic for tonight.
And the next question, what is the needling technique for the Jing well points?
Oh, thank you. I didn't put that in the notes. Okay, yes. So you can bleed them. You can also use a lifting and thrusting where you're emphasizing the lifting and pulling out. Or if you're using your fingers, you can actually scrape the Jing well point. So you just scrape it. And that was actually a traditional method. They used a little scooping needle, which was more like a piece of metal that would look like a scoop. And so you can do that with your fingernail and it kind of hurts a little bit, or you can even use your finger and do the lifting and thrusting of the point. So I'm doing my large intestine, but you could be doing that on the bladder 67 point.
All right. And then let's see. Oh, funny. Are you bleeding Jing well points or using the SDS on them?
You're not using the SDS. Again, it's just the releasing technique that you choose. So you could bleed, you could, again, remove it through, you could even, if you're doing 5-element acupuncture, you could do counterclockwise circles. That's fine.
Can you remind us what the essential oils that you used were?
Let's see, it was pine and I'm not an essential oil person. Jasmine and pine or Leta.
Perfect. And then is it okay to do gua sha in the same locations 2 and 3 days in a row, even if a lot of sha came up on the first day? Very
good question, because I typically tell people to wait. However, between gua sha sessions, if you're just doing gua sha like for other reasons, in this case, I would say try to find areas that aren't quite as red and bring the sha out more in those areas. If there's still a lot of sha, find some areas that don't have a lot of sha, and also as with gua sha, so it'd be helpful if you knew how to do gua sha. If someone's blood deficient in general, and there's lots of contraindications for gua sha, which you should also just pay attention to, like whether they're taking blood thinners. But if there's a ton of gua sha, a sha from the previous day, and that person is lightheaded or just feeling a little weak from that, then you need to pay attention to that and not go crazy in a second day. However, if they're overwhelmed and having a huge problem, then maybe you could use some different techniques to alleviate the symptoms that came up.
Would you do a divergent treatment on yourself?
I've never, maybe I have. I don't see why you couldn't. Yeah, you could, but yeah, you have to get really structured with yourself. Don't skip days, because I find it's easier to kind of let yourself off the hook.
This is a question I'm not sure you'll be able to answer, but I'm going to ask you anyways. Are there any practitioners like you in the Portland area?
I'm sure there are many.
That's Portland, Oregon.
Yes. DM me or email me. It's leta@alchemylearningcenter.com. And I actually have, I have someone in mind. So I can give you Ken's address.
Perfect. Elizabeth, if you're still listening, I just put Leta's email address under your question in the questions tab. So there are some bunch of questions about Daimai and comments about people wanting a Daimai webinar. So we know we need a Luo webinar, we need a Daimai webinar, 8 extraordinary vessels. I think I saw somebody else mention. So lots of things to work on for the next year or so.
Okay, good.
And then let's see, how about Morton's neuroma. Do you have anything to say about that?
You know, I've had some great treatments with Morton's neuroma, and they weren't divergent. So I think of it much more in the sinew area. I don't even do a typical sinew treatment. I work with nerves a lot with something that I call AcuTouch, which we could do another webinar. And AcuTouch is just this idea of releasing kind of the wind from beneath the surface using a vibrational technique. So in a way, it's a little like the divergent treatment, but only on the surface.
All righty. And then let's see, next question, moving right along. We're actually almost to the end here. You mentioned DSD is for placing things into remission and latency. I've also heard of DSD used to build resources prior to releasing toxins. Do you consider that different, or use the DSD just to build resources prior to doing the SDS?
I love that idea. Again, it's not my favorite strategy, but if that's how you think of it, I love that idea. I think that's a great idea. I tend to build resources through primary channel treatments, and maybe if appropriate, a lot of moxibustion and other strategies. That's how I work. So I love that idea. So my teacher, Jeffrey Yuen, says, if you decide you're a divergent channel practitioner and you only ever want to do divergence, you can treat anything with divergence. So, and that's true for the Luo system and any of those systems. So if you really get good at them, you can treat anything. So that would be a strategy where you would use DSD for exactly what you say, to strengthen the person. So that would be, for me, reframing how I think about it, which is fine. That's probably something that all of us need to do. And so we're constantly reframing how we think about how we treat people. So that's what I would say to that.
Thank you. And then somebody asked what about the brand and types of cups that you mentioned, which were the Dongbang cups, which we saw at Lhasa OMS, and I did put a link into the questions tab for that. So Anna, if you'd like to look at that, feel free. They are great cups, by the way. And then next question for you is, do you have any experience in dealing with divergence with COVID?
No, I have been working with Daimai with long haulers, and I've also had some Europeans have strong reactions to AstraZeneca as a vaccine that have been quite debilitated, and they also responded really well to Daimai. So I think I would go more with Daimai than divergence.
Alrighty, how about we do 2 more questions?
Okay.
All right. Do you have any experience treating ankylosing spondylitis with this treatment or with the 8 extras?
Yes, I think that divergence would definitely be a possibility, and I have treated it. And actually, I had quite a severe case that she felt quite improved. So I would say that, and Daimai could also be very appropriate. So, you know, you have to look at all the factors in all these cases. And also, I have to say that sometimes the age of the person really comes into play. And I have done it with people who are in their 80s for this particular thing, and it has been successful, but I have to be so slow with it. So delicate. So you can still do it. You just have to really take your time.
All righty. Would this treatment be too strong for a post-chemotherapy patient because they're so weak and not sure if gua sha is appropriate?
I agree. I would be careful there.
Okay. And then actually, how about one more? Because okay. What does it mean if there's no sha appearing when you do the gua sha?
That happens often. It usually means that nothing needs to be released, or your technique isn't quite up to, you know, getting a robust sha out. There's always that possibility, but most often it's that, or they are very blood deficient. So if their tongue is very pale, then, you know, it's not even a good thing to do a lot of gua sha. However, in this case, we're not doing gua sha for the reasons we normally do gua sha. So even if you're doing a very light application of gua sha and you're not getting sha, it's still better to do it because you're really opening the pores and allowing the surface to open up so whatever's coming out can release.
All right. Well, we cannot thank you enough, Leta. Everybody really, really enjoyed this webinar. We really enjoyed having you, and we're looking forward to having you back in October. So,
oh yeah, tell them what we're going to do.
I already did. Oh, I already did. I let them know in the chat. So when people, people were talking about it, so they do know that you're going to come back in October, and we'll probably have to plan a few more since there's so many other topics that everybody wants to hear about.
Yes, we decided to do ghost points around Halloween. Couldn't help it,
Sometimes you just can't help yourself. I thought it was too cute not to do. And our next webinar is actually going to be on Tuesday, May 25th. It will be Exploring the Small Intestine Sinew Channel with Matt Callison and Brian Lau from the Sports Medicine Acupuncture Certification Program. And we just want to thank everybody for showing up tonight. We want to thank Leta for her time, and we look forward to seeing you guys all next time.
All right.
All right, good night.
Thank you. Thank you, everyone. Have a good night.
You too.